Okay, foam rolling technique. I'm going to show you how to self-mobilize your entire lower extremity, treating the whole kinetic chain all the way down. Sometimes we have foot pain because there's something up higher in the chain that could be restricted, soft tissue-wise, or weakened for that matter. So there's many options for foam rolls. The softer 4-inch ones are less, less aggressive on your tissues when you're just starting with this stuff. I'm going to include probably a 6-inch roll in our package. Tends not to break down as quickly, but the white ones are softer than the black ones. Okay, I'm going to show you on the black one because I don't have a 6-inch white one here because we tend to use this quite a bit here for our athletes. So on the floor, okay, you want to hit the typically the quad first. Okay, you want to hit the quad in 3 different areas. Right down the middle, 45 degrees turn this way. No, pretty much 2 ways. Pretty much right in the middle, and then you turn 45 degrees over here. And then you turn 90 degrees and hit the ITB on the outside. Okay? Our procedure for this is to hit the quad because it's a longer muscle in 3 different zones. The lower zone, 5 or 10 rolls down there. The middle zone, 5 or 10 rolls there. And then the upper zone, 5 or 10 rolls there. You can get it over to get really up high into the hip flexor area, where the hip flexor inserts into the femur. And same idea. Turn about 45 degrees. Hit that lower zone there, middle zone, upper zone. Don't roll on the bone. That's your greater trochanter right there. And then same idea for your ITB on the outside. As you can see, I'm putting weight on my foot, weight on my arms to unload so I'm not putting too much pressure on my leg. I'm used to doing this, okay, so I'm pretty desensitized when it comes to this stuff. If you first start this, you want to go easy, same thing all the way through. Put more pressure on your foot and on your hands to take the pressure off of your leg. Okay? And working the bum. You work your left side, cross the leg of the leg that you're working and mobilizing. I'll be up like this or down like that and get in and work my upper glute. Okay? All the way through, same thing. 5 or 10 times, sometimes in this area because it's deeper tissue. Just find that spot where it feels like, oh yeah, there's a good knot right there, and then rest. And then your tissues respond by relaxing with the sustained pressure of the roll on that spot. Okay, hold 20, 30 seconds. You can do smaller oscillations as well. Okay, all right, that's the glute. And then get in and work your hamstring as well. I'll put my other leg on that leg just to kind of create a little bit more down pressure. Same idea, work the lower level, lower zone, middle zone, and then the upper zone as well. Okay, and I'm spending, probably 30 to 60 seconds each muscle group all the way through. If I find a spot that needs more work, I'll kind of hang out a little bit. I'll actually even turn about 45 degrees to hit the junction between the hamstring and the ITB. Sometimes I'll get in over here like this and work that as well and hit those 3 zones again. And usually that middle zone, right where the hammy and the ITB meet, can be a real touchy area. And like I said, restrictions up in your hamstring can affect and overload the tissues in your foot. So the more we get this stuff loosened up here, the more stress it can potentially take off the rest of the chain all the way down. Okay? You can work your calf on this as well. Down pressure on there, and see I'm pushing my body weight up. And then you can actually load it and then work on some motions through here. So I'll load it maybe a little bit more this way. And there's a little knot in my calf there. I'm just back and forth. Same idea almost as a pin and stretch. I'm putting some load into that tissue and then moving the tissue through that load. That helps to milk out that knot that's in there. These are just options for you. But it's good to be doing your foam rolling stuff. Like I said, on the protocol. If you can, get in there, twice a week as well. Okay? And that pretty much hits all the areas for your foam roll. So good.